Hello everyone, today I will be presenting on abortion regulations around the world. So to start off my presentation, I'll be going over the outline. I'll be first giving a small introduction on myself. I will then be giving background on the importance of abortion. I will then be comparing abortion legislation across the world. And lastly, I will be telling the audience what you can do to support those who would like to receive an abortion. So a little bit about myself is my name is Arni Kumar, and in the fall, I'm going to be a freshman at the University of South Florida. I'm born and raised in Pinellas Park, Florida, and some of the extracurriculars I really enjoyed in high school were Girls State, where I got to go to a national conference where we got to exercise government, and the Pulsar Project, where I sold bracelets for those from Nicaragua and Guatemala. Apart from the political side, the medical side of things were where I volunteered for Best Medical Academy, where we went into rural communities and helped those understand their healthcare. And my future plans are to be a psychiatrist, as I believe that mental health will be a prominent issue in the future. So to start off, what specifically is an abortion? An abortion is the deliberate termination of a human pregnancy, and it's most often performed during the first 28 weeks of pregnancy. So I think that to understand why legislation is the way it is today, we need to see what happened in the past. So during the early 19th century, the choice of abortion was an extremely private matter. Most women saw pregnancy as lack of menstruation rather than a new child being born, and they would take herbs from their garden to start their menstruation again. And this is until the term quickening originated. And quickening just means that it's the first signs of fetal movement. In the United States and England in the 1800s, abortion was legal as long as it occurred before quickening or in the early stages of pregnancy. Although it's quite hard to prove whether a woman had observed quickening, making criminal charges extremely hard. Abortion was still accessible to those who could pay for the medical service or the pill, and those who could not continue to use herbs to induce abortion. So then in the late 19th centuries, abortion was completely outlawed during the 1860s and 1880s, and that's a complete 180 from before. And this was done for two big reasons. The first is medical communities need to establish their validity and restrict competition from midwives and homeopaths. When the AMA was established, or the American Medical Association, its message was that quickening did not exist, and there was not a clear distinction between earlier and later stages of pregnancy, therefore leading to abortion being illegal altogether. Physicians would then team up with lawmakers to support such ideas, since the government was concerned with birth rates in the country. Social scientists started to record birth rates nationally, and that caused the fear that if women chose to have fewer children, countries would then be unable to participate in warfare due to their lack of militia. With doctors and lawmakers on the exact same side, churches were then further influenced to believe that abortion at whatever stage was immoral. So although abortion was illegal, it did not seem to stop the procedure at all from occurring. During the 1930s, during the Great Depression and global economic crisis, getting an abortion was most logical for many families as they did not have the resources to support another child. Many women started to receive unsafe abortions, and the Kenzie Institute estimated that in the United States, 17,000 women died each year from abortion-related complications during the 1930s. And although many doctors and governments worldwide still saw abortion as a sin, the feminists of the 1960s took two different approaches. American feminists stated that women can control their bodies without the interference of the government, and the European feminist perspective was that unless governments can provide socially and economically for the child, women should have the right to an abortion. So furthermore, the two big Supreme Court cases that helped support abortion in the United States were Roe versus Wade, which stated that a woman's decision whether or not to terminate her pregnancy is a constitutional right, and medical doctors had the right to practice abortion, and Doe versus Bolton, which stated that a committee no longer had the right to decide whether they had a right to an abortion. So in Europe, one of the big abortion acts was the Abortion Act of 1967, which stated that if pregnancy tampered with the mental or physical health of the mother, it was legal. Although this is not the best option, it was still a progressive idea for that era. So now we're going to look at abortion regulations worldwide today. So if the country that you see in here is dark red, that means 90 million women, or 5%, do not allow abortion in the world. It doesn't matter if the mother's health is at risk or if the fetus's health is at risk. If the country is in light red, that is 316 million women, or 22%. And that means that if the mother's physical health is at risk, they can receive an abortion. In the yellow, that is 240 million women, or 14%. And that you can only get an abortion if a woman's health is at risk. And certain countries will include mental health in that, but not completely. And this also includes fetus abnormalities. If the country is in turquoise, that means that that is 380 million women, or 23%, and that is social or economic background will decide whether you can get an abortion or not. And lastly, if the country is in blue, which is the best, it's 590 million women, or 36%, meaning that it's based on the gestational limit of each of those countries, so it can range from weeks to months. So as we can see here, from the 1990s to 2000s, there has been a lot of progressive change in abortion legislation internationally. And I'm going to highlight on a few major countries that have had a different abortion legislation outlook. So I'm going to start with China. And China had, in the 1970s, had the one-child policy because their country was overpopulated, which means they permitted abortions most of the time. As their population tended to decrease, in 2016, it became the two-child policy, and then 2021, it became to reduce medically unnecessary abortions. And they never really specified what medically unnecessary meant, and abortion access varies by region currently. Now, looking at Kenya, abortion laws used to be based on the British Penal Code. So taking back into history, whatever the British colony decided, that was their abortion policy. But once they became independent, they allowed abortion to be overturned as if the mother's health is at risk and as well as rape. Now, this is completely opposite to what happened in Poland, because during the Soviet era, they were more liberal about their abortion policies, and over time, they became more strict, stating that every human being shall have an inherent right to life from the moment of conception. And now, 100,000 to 150,000 illegal abortions take place each year just in Poland alone. And Honduras is the last country I think I'd like to go over, and they have the strictest abortion policy, meaning there's no abortion allowed at all. Maternal mortality rate is therefore 37 out of every 100 women, and 50,000 to 80,000 unsafe abortions happen each year. So you must be thinking, although illegal abortions are still occurring, why is this a problem? It's because banning abortion leads to around 45% of all abortions to be unsafe, and that takes place in 97% of developing countries. And every year, an estimated 22,000 women die from unsafe abortions because they can't get it legally. So lastly, what can you do as an audience to help those who'd like to receive an abortion? Firstly, I'd like to talk about voting, especially in the United States with Roe versus Wade being overturned. If you see where your representative stands on, you can decide what the future of abortion legislation will look like. So please go out and vote. Please encourage your parents to vote. Whoever you know who's above the age of 18, please encourage them to vote. Next, you can donate. There are abortion funds that will help women who would like to receive abortion cross those state lines to receive a legal abortion or even just access to the pill. And for those who have been charged with a criminal case, to receive lawyers. Lastly, as others in our presentation have listed, is to spread factual information and to spread information even on the topic of abortion, and not just women. It's very important that men advocate for this topic as well. So here are some of the references I used. Thank you so much for watching our presentation today. I'd like to thank Johns Hopkins and the Global Health Leadership Conference for allowing me to share information today. And if you have any questions, any comments, feedback, or just like to discuss the issue in general, please don't be afraid to reach out. Thank you.